There are many potential risk factors for stroke, and it is rare for any single factor to be solely responsible. Additionally, there are two types of stroke that occur under different circumstances. However, several significant risk factors can decrease a person's likelihood of experiencing either type of stroke. These include advanced age, a family history of stroke, lifestyle choices, and various medical conditions. The first and more common type of stroke is an ischemic stroke. This occurs when an artery in the brain becomes clogged, most often by a blood clot. Blood clots can develop on top of damaged atherosclerotic plaque in the arteries leading to the brain. They can also form in other parts of the body, detach and travel through the bloodstream to the brain, where they can block one or more of the brain arteries. This typically happens due to issues with the heart, often related to rhythm disorders or structural anomalies. To clarify, atherosclerotic plaque is a buildup of harmful substances, such as certain types of cholesterols, on the walls of blood vessels. Over time, this buildup can harden and calcify, creating a bulge in the blood vessels that can obstruct normal blood flow. This bulge is unstable and may erode, exposing its inner structure to the blood, which can lead to the rapid formation of the blood clot at the site of erosion. This further obstructs blood vessel, especially the artery in the brain. Atherosclerosis is a complex process associated with genetic predisposition and various risk factors. I plan to dedicate an entire video to this topic. The second, less common type of stroke is a hemorrhagic stroke. This occurs when a brain artery bursts, causing blood to leak into the brain. An artery typically bursts due to structural issues with its wall. Common causes include aneurysms in the brain arteries, blood vessel malformations, high blood pressure, trauma, brain tumors, or use of illicit drugs. An aneurysm is a sac-like dilation of a brain arteries that weakens the arterial wall, making it more vulnerable to bleeding. Aneurysms can be associated with specific genetic disorders, atherosclerosis, high blood pressure, infections, smoking, advanced age, and being female. High blood pressure places significant stress on the arterial wall, which can lead to degeneration and dilation. Brain tumors are supplied by low-quality blood vessels that are prone to spontaneous bleeding. The use of certain illicit drugs, such as cocaine and amphetamines, is linked to hemorrhagic strokes, as these substances can cause sudden spike in blood pressure, which may lead to the bursting of brain arteries. Now, let's discuss the risk factors for stroke, which can be categorized into two groups. The first group consists of risk factors beyond our control, including advanced age, gender, family history, and ethnicity. Individuals over the age of 55 have a significantly higher risk of stroke. Men generally face a higher risk of experiencing a stroke, while women often deal with worse outcomes. Additionally, if someone in your family had a stroke or heart attack before the age of 55 for men or 65 for women, you are at higher risk. People of African, South Asian, and Hispanic ethnicities also have an increased risk of stroke. The second group includes risk factors we can influence, such as smoking, drug use, obesity, high blood pressure, diabetes, and elevated levels of bad cholesterol. This group of risk factors is arguably more crucial when considering stroke risk. For instance, a person who does not smoke, maintains a healthy body weight, keeps their blood pressure under control, and does not have diabetes will have a low risk of stroke, regardless of other risk factors. It is well established that smoking causes cancer, But it is less recognized that smoking also accelerates atherosclerosis and is linked to a higher risk of stroke and other cardiovascular diseases, such as heart attacks. Diabetes poses significant dangers because poorly regulated blood sugar levels over a long period can damage blood vessels throughout the body, including those in the brain. This increases the risk of stroke and numerous other cardiovascular diseases. It is important to note that diabetes itself rarely causes death. People with poorly regulated diabetes typically die from cardiovascular complications, such as strokes or heart attacks. High blood pressure adds stress to the walls of the blood vessels, potentially causing structural damage or accelerating atherosclerosis. It predisposes affected individuals to both types of stroke. In the medical community, there is a saying, there is no stroke without high blood pressure. Obesity is another concerning risk factor. It is linked to various hormonal and cardiovascular disorders. Particularly concerning is abdominal obesity, as belly fat is hormonally active, producing or converting hormones that can lead to increased health risks.